Hello, everyone. My name is Gaetan Khim, and I'm the Deputy Clinical Team Lead at Diagnostic Microbiology Development Program. And today I'm going to talk about hand hygiene monitoring in a hospital in Cambodia. Just a few words about DMDP. We are a microbiology organization that provides technical assistance to labs. However, our team also consists of doctors, pharmacists, and nurses who provide recommendation on infectious disease management. We're also very data-centric, and we use digital tools to provide recommendation on improvement of quality services in the hospital. And we also provide recommendations and guidance to Ministry of Health, WHO, and hospitals. So washing hands saves lives, and how does it do that? So it helps mitigate hospital-acquired infections, which are a big problem for both high-income and low-income countries with high rates, high mortality, and high financial burden. And you can see in the picture on the right, there is an unfortunate case of a patient who had Klebsiella pneumonia bloodstream infection from poor IV catheter care, which fortunately did better on antibiotics and source control. So as Lord Kevin puts it very correctly, if you can't measure something, you can't improve it. However, tools at our disposal for hand hygiene monitoring doesn't really make that easy with clipboards, pen and papers, which on the next slide will show you is one of the bigger problems is the Hawthorne effect, where audited staffs in hospitals may actually give you a different representation of what their actual practices are. And the second problem is the data analysis. So in a low-income country, pen and paper, you have to do double entry in an Excel spreadsheet, run the numbers, and make sure that all the graphs link with all those numbers, which can be actually quite a daunting task. So what we did is we went with Kobo Collect, which is a smartphone application for participatory surveillance. And we developed the tool from scratch and came up with an audit system that basically looks at hand hygiene compliance using 3 questions. The first question being, what healthcare professional did you look at? Was it a doctor? Was it a midwife? Or was it a nurse? The second question being, what moment were you looking at? Was it before or was it after hand hygiene? After touching a patient. And the third question is, did the healthcare professional actually did the hand hygiene or did they not do it? And this question repeats for a number of times. And once the data is being collected, it's being sent to the Kobo toolbox for data storage, similar to an Excel spreadsheet. However, in this case, there's no need for double data entry. And then the data is extracted in a CSV file, which is then translated by a program that we wrote at DMDP using Python and Streamlit to generate this automated report. Although I'm not allowed to show you the CMRIP data, which is proprietary to them, between June, July, and August, we've collected 8,500 opportunities, which was very helpful data for the hospital management to decide on what intervention they should decide on. However, we're very mindful about bias, and we understand that the auditors may not provide the most reliable data. However, we have checks in place, such as an automatic clock to know how long they took to fill in the data. We also can look at the individual audits, and we can also look at the aggregated Python reports. And with all that information, we have a discussion with the auditors in order to improve the data collection. Finally, in the sense of bidirectionality, this is a feedback session to the healthcare staff to which the data was collected from. And you can see on the picture, this is the hospital director providing recommendations. So of course, sustainability is the end goal. So we're in active discussion with Ministry of Health so that they can house the server. We're also provided all the tools so that the hospital can collect the data themselves. And we've also done training of the trainers with the IPC teams so that they can analyze, validate, and feedback the data to the ward and the hospital management. So thank you to all the teams. So I'd like to thank DMDP for all their help in the CM management, and a particular thank you to the auditors extraordinaires who have collected up to 1,000 data points on this activity. Thank you.